absolute pleasure to have you all here tonight for Nurses' Role in Advancing Democracy, Advancing Social Change, Legislation, and the Political Landscape is a space where the skills of nurses are needed. Tonight, we will hear from subject matter experts engaged in innovative efforts and learn more deeply around civic engagement, elected office, and efforts to shape and advance our communities and society. So it is with extraordinary pleasure that I get to introduce our first subject matter expert. Aaliyah Bhatia is the Executive Director of Vote ER and Civic Health Month, where she works to bring voter registration into healthcare settings, including emergency rooms, hospitals, and community health centers. She completed her master's in public policy from Harvard Kennedy School as a Sheila C. Johnson Leadership Fellow and is a graduate of the School of Foreign Service at Georgetown University. Aaliyah was drawn to the connection between health and democracy through the combination of being raised by parents in the medical field and various defining experiences while studying teaching and working on housing and health initiatives. Aaliyah started her career as a high school educator and then as a strategy consultant for Boston Consulting Group. She prioritizes diversity and inclusion in all of her endeavors. Aaliyah resides in Washington, D.C., where she works to realize Vote ER's vision of healthy communities powered by an inclusive democracy. Welcome, Aaliyah.
Hi, everyone. It is so great to be here with you. Before I dive into the slides and some of the things that I want to share, I want to share something on more of a personal note, especially given who's in this room. A number of years ago, I moved from finishing graduate school, moved back to Atlanta, which is home for me, and I hope to be back there soon. And in the process, I went through this weird shuffle in health insurance, and it was like just a really awful stretch for me. But once things stabilized around health insurance, I wanted to find a primary care provider for me. And as I was looking around, figuring out like what would be best for me, one of the things that I really wanted was someone who I could trust and confide in and like have real, time with. And so I made the decision for my primary care provider to be a nurse. And it's one of the decisions that I am just so grateful for in my life. And just something I wanted to share because of how important the profession you're in has played a role in my world at a time when I was in a really vulnerable situation. And so I'm grateful to you all for that. I'm so excited to share a bit about Vote ER, and it's so great to be here alongside our friends at the American Nurses Association and Healing Politics. You're going to hear about a wide range from the different speakers on this call of the different ways that you can be involved. So I'm going to lay some foundation and groundwork. And I want to start with the story of how I came to Vote ER as a way to get us started. So I was in Atlanta, and I was in one of those programs where they really want you to go deep in community. So they send you on a fire ride-along, and they send you on an emergency medical services ride-along. And I suspect there's some folks in here from the South. I'm a native Metro Atlantan. I've lived in Louisiana, worked in Mississippi and Alabama. So, kind of the Metro Atlanta region is like a really important place to me. So they had me go on this emergency medical services ride-along with Grady Hospital, which is our safety net hospital in Atlanta. And in the dead of winter 2019, I knock on the door, and this guy opens the door. He's the manager on duty, and he kind of looks me up and down and is like, okay, I'll take you around town, show you all the different things that our EMTs are doing to support our community. We quickly discovered we were very different people. He was from a really different part of Atlanta than I was, a couple of generations older than me. We had different perspective about a lot of topics. But as we were riding around town, we saw the exact same things, which was his team was responding to things that were not at all in scope for him to be responding to. They were responding to homelessness, to food insecurity, to somebody's health insurance changing in something that they used to be able to afford as a medication now was not affordable to them and creates an emergency. And so at the end of this ride along, I asked him, if I give you a magic wand and you can only do one thing with it, what is your one thing? And his answer surprised me. He said, Aaliyah, if I could only change one thing, I wish all my patients would vote. Because if all my patients voted, that would ensure that local elected officials put money into jobs training, made sure that there was good housing, affordable housing for everyone. They put a grocery store in every neighborhood. And when I needed to get someone an ambulance, I would have the money to get them one on time. A month later, I hear about an ER doctor in Boston who is starting this thing, Vote ER, and wants to start to build it up. And I just felt it was serendipity, and I hopped on board and was just honored to be on the journey with Dr. Alistair Martin to build Vote ER and to support folks through the ANA and many other spaces to support nurses to be able to engage in this. So I'm going to talk about a couple quick things, the link between voting and health, what VoteER does to help, some legal FAQs about how to talk with patients or colleagues about voting, and next steps you can take. And then some of the other folks on this call will tell you how to go even deeper or tackle this in other ways. So let's talk about the link between voting and health. When we look at evidence at the global, national, state, and local level, we see this link between voter participation and health outcomes. And actually, we see exactly what that Grady EMT was explaining to me in his explanation of what he would do with the magic wand. When you look at local elections, particularly nonpartisan elections, what you see is that when you have more people from more backgrounds voting, both homeowners and renters, folks from all different racial backgrounds, folks from different socioeconomic backgrounds, when you have more of a range of people voting in a local election, those local governments put as much as a third more into social services such as public education, such as public housing, and such as public health. And so there's this direct link between addressing those social determinants that y'all are so familiar with that you know are impacting your patients' lives and making sure that our patients have a say in the elections process, make sure their voices are heard. One of our advisors is Daniel Dawes. He wrote a book called The Political Determinants of Health, used to work at the Morehouse School of Medicine. And he talks about how voting is arguably one of the most important of those political determinants. And that's the one that VoteER primarily focuses on. We want to go upstream of the social determinants and get to those structural determinants of health and really focus deep on those and support health professionals like you to be able to support your patients and communities to be able to engage in it as well. Why does voting matter? Because when patients don't vote, and I suspect there's folks in this room who have made phone calls for a political campaign, or they've, helped to reach out to people, door knock for a political campaign. Those lists are people who have already registered to vote and have demonstrated track records of voting. So eventually, if those are the only lists that a campaign uses, they are missing the folks who are less likely to vote, who are younger and are now just eligible to be able to vote. They're missing folks who maybe they've moved and things have changed and they're registered at the wrong address. They're basically missing a whole set of people who are critically important. And these are the folks also most vulnerable within our health systems. So a really, really important group of folks can be missed out when a campaign labels someone an unlikely voter. And why does this matter? Just to put it in tangible terms, I think many of y'all are very familiar with the fact that there is now a big opioid sort of settlement process happening. And it turns out that it is the locally elected officials who are the ones who are making decisions about how to disperse those funds, what things to use those funds towards, which means that often hundreds of votes can make the difference in who is spending millions and sometimes tens of millions of dollars on our community's health and addressing outcomes like substance abuse disorder and opioid use in our communities. So naming that as one, example that is more focused on the health side of health, but you can imagine all the social determinants that are also being impacted by coin flip elections, where when more people vote, you have more pressure on elected officials to do the right things. Important for everyone here to know is that in the US, you have to be registered to vote before you can vote. In order even to sit at the table, you have to register to vote. And there's about 72 million people who either are not registered or are registered at the wrong address, including, I think, about 8 million folks who have come of age in the last 2 years and so have not yet in a past presidential election or midterm election been eligible to vote. Why are they not eligible to vote or registered to vote? 62% of them say, I have never been asked. They don't have a recollection of someone saying to them, hey, are you registered to vote? And can I help you register to vote? And so that's a really big problem for folks to not yet have had that experience of being asked and engaged in the process. And the folks who y'all see in your waiting rooms, in your clinical spaces, are often at that intersection of folks who are either not registered, or if you're like me, you're from Georgia, registered but not voting frequently, and people most marginalized by our health system. These are young folks, low-income folks, and folks of color who we can uniquely help because of the work that we do. Also, oftentimes within our community of health professionals, we see lower voter turnout. And so we see that in different parts of the field and at different times, but this is just one example where we saw in this particular set of elections a lower voter turnout from health professionals than the general public. The American Medical Association recognizes the link between voting and health, as do a number of sort of health-related bodies like Health and Human Services. And so just naming, there's now recognition of the importance of this connection. And so now briefly to share with you what is the role that VoteR plays and how it helps. As you know, and I know that the ANA and this community talk about this often, y'all are the most trusted messengers. Nurses have been the most trusted professionals for 2 decades. And one thing that's particularly unique about this community is that as nurses, you are much more resilient to questions of things happening out in the world and people's perceptions. There's been some fluctuation in the trust in doctors over time, for example. Y'all are rock solid. The perception and experience with nurses is just so strong because of the same reason I chose a nurse to be my primary care practitioner. So naming that there's a unique perspective and bedrock of trust that you bring to our democratic process, and that 83% of Americans are going to see a health professional this year, and so we have a unique surface area and reach in the work that we do. At VoteR, what we do is we create fast, easy, simple, nonpartisan tools. This is my VoteR badge. You can track how many people I've registered to vote using the code on it, so I can get a sense of how effective I'm being. We provide these badges to all different professions within the health professional field. We also provide things like text messages that community health centers can send, or email language that organizations can send on National Voter Registration Day. So we try and provide resources that support each organization in a unique way. And every organization picks a different set of things from the menu of what will work for them. Now, the question you might ask is, well, tell me a little bit about what it means to talk to my patients about voting. So I want to give you a little bit of the legal FAQs about this so that you have some context. There's longstanding precedents for particularly 501c3 organizations, which many, many hospitals and health centers are, to be able to do voter registration. And much of this sort of precedent extends also for corporations excited to do voter engagement and voter registration. But basically, there is a National Voter Registration Act of 1993 that laid the framework and foundation for organizations to be able to do voter registration. It basically standardized the process. And additionally, what it said is that we have an obligation to support those who are going to be hindered by disability, for example, to be able to register to vote and have access to the vote. So it also has an explicit health mandate in there around supporting folks who may face health-related barriers to voting, that we need to support them and make sure that they have access to the vote. What is in bounds? Voter registration, voter education, and get out the vote. At VoteR, we work across all 50 states, rural and urban, every single day of the year, odd years, even years, all the time. So we want to make sure that our tools and resources are used in a way that sustains voter engagement over the long haul, and that we're making sure to constantly engage people around the importance of their voice, because there are elections happening year-round. There were elections yesterday in a number of states that probably many of you live in. What we try and do is make sure that our tools are undisruptive, optional, and nonpartisan, make sure that they are not getting in the way of your clinical practice. That is our commitment to you. We will always look for the easiest to use tools. We will look for the most updated materials and make sure that they are as effective as possible for you. What can this look like? On the left, you see one of our hospital partners, Einstein Hospital in Philadelphia. Every year they get together with Penn Medicine, Children's Hospital of Philadelphia, and then them as Einstein, and they run a citywide National Voter Registration Day drive. They do that as kind of a citywide initiative in partnership with actually the Board of Elections is right there visiting with them. So they do it in direct partnership with their state Board of Elections. Then you have our community health centers. Our community health centers often put up posters as well as leave handouts. And then they text people on specific dates that are voting holidays. So on National Voter Registration Day, hey, we're celebrating National Voter Registration Day today. Will you join the millions of Americans who are registering to vote and register at your current address? Boom, touch their entire patient community, help them update their registration, got them ready to vote. And then for nursing students, as well as other health professional students, we run a competition called the Healthy Democracy Campaign, and that's what you see on the right. So the last thing I think I want to name before I get into like what you can do is, what can this look like? You can put this in the social history section or the rooming component as you're getting started with someone new. Do you smoke? Do you drink? Are you wearing a seatbelt? Are you safe at home? Are you registered to vote? Is one way to layer it in. On our website, you'll see other examples of conversation starters and ways to talk about voting. And we actually have a training that we'll put in the chat shortly that if you want to go deeper, you can join for that, and we'll actually help you practice with other people. What you can do, point people to posters, badges, and handouts, tell them that you provide this as a service. Make sure you are very clear you don't endorse a political party, and help patients fill out the registration form while remaining neutral. The only group of people in this room that I would say I would be a bit more cautious about, where we have a disclaimer anytime we send VOTR materials, is if you are in Texas. I do want to name, we generally do not have as much support for the work in Texas, in part because their laws are a little bit different than other states. But if you're in any other state, these rules are the rules that apply to you. And so just want to name that aloud for any of our Texas folks in the room. And as you can see, major VPs of government relations, such as at Einstein Health, really see this as a way to engage people beyond the clinical walls in their work. Last thing, people get energy out of this. It's something that is joyful for folks. We had one person who was like, gosh, as I was training in the health profession, I thought I was going to be able to really impact people. But then I felt like so many of the things impacting my patients were happening beyond the clinical room, and I wanted to do something about it. So just naming that aloud. All right, so what can you do? Because I want to hand it off for our next steps. Today is Civic Health Month, which is why we're so excited to be doing this with the ANA right here in August. Now is the time to get your VOTR badge. It's the time to get in touch with your institution about the way they want to do voter engagement. And then a really big day is National Voter Registration Day. Some hospitals are like, Aaliyah, we can't do this voter registration thing year in and year out. And we're like, could you do it this one day when everybody else is doing it? And that makes it so much easier for them. So give them one day that they can focus and concentrate their work. We provide resources for National Voter Registration Day, and then 2 other important dates: Vote Early Day, and then the last day to vote, your deadline to vote, is November 5th. So there's 2 things, and my teammate Allie will drop the links for this in the chat. We recommend going ahead and ordering your VOTR badge. It takes a couple weeks to arrive. We want to make sure you have time to use it and to make sure you can engage patients around it. And so this is actually a nurse from Athens, Georgia, who talks to all of her 18-year-olds about voter registration. She's a rock star. We want all nurses to be like Tianya Lawrence, who's a total rock star in our work. And then second, if you're like, okay, Aaliyah, this is interesting, but I actually need the deep dive on how to talk with patients, we provide that. We'll provide a 75-minute session where you can actually get into a breakout room, practice with somebody else in the field, switch places, do the role play, and go from there. The last thing I want to name is there are 100,000 elections on the ballot this fall. 100,000. That means that people from dog catcher all the way up to president are on ballots this fall. And some of those roles are going to make really important decisions about how clean our water is, whether we have parks in our neighborhood, how near the nearest grocery store is. And in this country, in 2020, when we had record turnout, 1 in 3 eligible Americans did not vote. We are going to need all of us, including the health field, as a part of this journey to make sure that when we talk about record turnout in this country, that we're talking about everybody who is eligible being able to vote. And you can be part of that movement of making sure we can cement this idea of record turnout as being something where everyone can participate, where those 8 million folks who just turned 18 can participate. Let's make sure that this is truly a movement that incorporates everyone's voices. And we're so honored to be on the journey with you and in partnership with you. So that is what I have for you. And I'm so thrilled for you to hear from some of the folks who are coming up from Healing Politics in the ANA.
Thank you so much, Aaliyah. Amazing presentation. I have a follow-up question for you. I hope everyone can engage and put questions for Aaliyah in the chat. We're going to get to questions and have a group discussion at the end of the lounge. So please, please feel free to place your questions in the chat. But I just have a follow-up question before we turn it over. You mentioned sustainability, and we know how important sustainability is when we're thinking about any innovative endeavor, that long-term perspective to ensure, just to your point, that it's not just a here, but it's future framed and encompasses that perspective. Can you share a little bit more of some of the practices you've used for creating long-term sustainability?
Yeah, I love this question. The first one is that one of the things that VOTR does is we try and make sure that we weave voter registration into existing systems, so that on the one hand, we want to lean in on the relationship that nurses, for example, have with their patients, but at the same time, y'all have so much to do. We don't want to give you one more thing to do, right? So what we've done is we've built a relationship with Epic, where the Epic electronic health record system can incorporate VOTR straight into its systems. As one example, we've got a relationship with Health and Human Services to work on getting it into the health insurance exchange for when people sign up for health insurance. And so we're making sure that we are working through all the different ways in which systems can support this, so that over time it is less relying on individuals to pull the weight of American democracy and more the norm for what our systems support across the country.
We are going to go ahead and transition to Lisa Summers. It is my absolute pleasure to introduce her. And again, if you can, please feel free to continue to engage in the chat. That would be wonderful. Lisa Summers sees healing politics as the culmination of a career grounded in clinical care and education before expanding to policy and advocacy. Lisa practiced clinically for 20 years as a nurse and midwife, and held faculty positions in schools of nursing and medicine before shifting to health policy work. She spent 11 years at the American College of Nurse Midwives, where she was the Director of Professional Services, and held policy positions at the American Nurses Association and Centering Healthcare Institute. She has spoken and written widely on healthcare policy and advocacy. For 10 years prior to co-founding Healing Politics, Lisa taught health policy at Yale School of Nursing. Welcome, Lisa.
Thank you so very much to the team at the Innovation Center for choosing this topic, this very timely topic. And thank you so much for including healing politics in this. We are really thrilled to be here and to share a little bit about our work. So first, I thought I would tell you the birth story of healing politics, how it came to be. My guess is that there are a lot of you on this call tonight who either have a DNP or you work with a DNP program and DNP students. So you might be interested to know that Healing Politics started as a DNP project. As Olivia said in the introduction, I was teaching health policy at Yale School of Nursing, and in 2018, Kimberly Gordon and a colleague from North Carolina came to Yale for their DNP. Now, one of them had run for office and Kimberly had been her campaign manager. So I was really intrigued by that history and came to the decision that for their project, what the question they were going to look at is, why are nurses so underrepresented in electoral politics, and what might we be able to do about that? So, long story short, their project came to be to develop a campaign school for nurses and midwives. Now, campaign schools are actually not as innovative as I thought they were at the time. There are actually many hundreds of campaign schools around the country, but this was the first campaign school designed by nurses for nurses. It was scheduled to be held in New Haven, Connecticut in May of 2020. Now, when I give this talk in a live audience, that's usually where I hear a groan, because we know what happened to things that were scheduled in May of 2020. So it was canceled, and they graduated without ever having been able to hold that campaign school. But we were so committed to this idea, and there was such energy around this idea. There were so many nurses and midwives who were like, wow, yeah, why are we so underrepresented, and why can't we get more of us to run for office? So we formed Healing Politics to carry on that work. We are a 501c3 nonprofit, nonpartisan organization, and our mission is to inspire, to motivate, and to train nurses and midwives to run for elected office up and down the ballot, while building a culture of civic engagement within our professions. So the picture on the left here was May of 2023, when we were thrilled to, in fact, hold almost 3 years to the day later, that first campaign school for nurses and midwives. We were thrilled that Tim, who you'll hear from later, joined us for that. And then the other group picture there is the 2024 cohort for the 2024 campaign school. So I will tell you a little bit more about our work, but moving on, sort of talking about the big picture. Why are we here pushing this conversation about politics? Because, as this wise person said many years ago, just because you don't take an interest in politics doesn't mean politics won't take an interest in you. One of the things we hear from nurses a lot is, nah, I just don't want to be engaged in politics. And I'll say, Kimberly and I are both kind of political junkies. And I have to say, sometimes in the last few years, we've been a little turned off by the politics in our country. So we get that, but we really want to try to turn that politics is a mess, politics is dirty, why would you want to get involved in politics? We really want to turn that around and talk about the importance of politics. And the fact, as one of our board members, Dawn Adams, a nurse practitioner who served in the Virginia legislature, what she said early this year when we were talking about how hard it was to inspire people to get engaged in politics early this year, she said, you know, politics is just another word for our form of governance. We are a government by the people, of the people, for the people. And so we have to be engaged in that. And the other interesting thing, you know, nurses always make great analogies. She said, you know, it's kind of like disease. It isn't going to go away. So who better to fix politics than nurses? One of the reasons it's so important for nurses to be engaged is for nurses to tell their story, and for policymakers and stakeholders to really understand what we do, and to understand the nuts and bolts of that. I think if there was any silver lining in the pandemic, perhaps it was that there came to be a deeper understanding of what nurses do. One of the things I think we've gotten better at as a profession over my career is the work of advocacy. Going to Hill Day, telling our story to elected officials. Our professional associations, from the ANA, all the specialty associations, provide us with a lot of good mechanisms to do that. And that's really important. One of the things we've learned in the last couple of years is that even nurses pretty comfortable with advocacy are often a little less comfortable with politics and with political involvement. So that is where we try to focus most of our energy at Healing Politics. The other thing I'd like to say, sort of in the big picture and convincing you, I bet a lot of people on this call don't really need to be convinced of the importance of this, but as you think about convincing your colleagues, is that the role of advocacy and political engagement is actually part of our professional responsibility. And I want to send a kudos to the staff at the Center for Ethics and Human Rights at the ANA, who've just wrapped up. Well, I guess they're still involved because they're reading our feedback on this revision of the Code of Ethics that they look at every 10 years, I think it is. But I have on this slide, and I won't read it all, but to make the point that it is a professional responsibility for us to be engaged, to collaborate with others. One of the points that Aaliyah made really well is the importance, the impact on health disparities. These are all sort of foundational principles to our profession of nursing. One of the things that's a really important message is that representation matters. I was really struck by Aaliyah talking about the range of people voting and the impact that that has. Well, the range of people that, there it is, that serve in our elected bodies is also critically important. When our elected bodies better reflect the people that they serve, we get better public policy. And political scientists have actually studied this. And it makes a lot of sense to us, but there's actually some political science behind this. So what do we know about nurses serving in elected office? Well, there has never been a nurse in the US Senate. Right now, we have 3 nurses serving in the US House. Some of you may have seen the news yesterday that Cori Bush from Missouri, who's one of those 3 nurses, lost her primary. So Cori will not be coming back to the next Congress. The other 2 nurses are up for re-election, Jen Kiggins in Virginia and Lauren Underwood in Illinois. We have about 68 nurses that serve in state legislatures. That's not many when you look at the total number of state legislatures. There are 14 states that have not a single nurse in their legislature. And so what kind of health policy is being made without the voice of nurses pulling the lever when it comes time for voting and influencing their colleagues? One other thing that's not on this slide that I really want to stress is the importance of what we call down ballot races. So your school board, your water board, your city council, those are all incredibly important positions. And for many nurses who may not have a deep background in political involvement, that may be a more accessible way to enter public service, running for your school board, running for your city council, running for a local race. Because again, as Aaliyah pointed out, those offices often have tremendous control over budgets, including the funds that Aaliyah mentioned, as well as all kinds of issues that impact our daily life. So oftentimes nurses will say, look, yeah, I know health policy and I feel pretty comfortable that I can talk about health, but gosh, what do I know about education or transportation or these other issues that elected officials have to deal with? Well, I have 2 answers to that. One is they don't teach those things in law school either. And the vast majority of our elected officials are lawyers who don't know any more about that than you do. But also, I would suggest that you actually do know a lot about these issues. You know, let's look at education. Think about how health literacy impacts your practice and your ability to help patients in the way you need to. Think about transportation. Does a patient have to take 3 buses to get to your clinic? You know a little bit about transportation policy. So I would suggest you do know a lot about these issues because as a nurse, you see health in all policy. And nurses are really well suited to run for office. We've got this list here of qualities, and I always love giving this talk and asking the audience what qualities they think nurses bring to elective office, because very often they word these in a different way, they bring up different ideas, so I'd love to hear from you. But think about what you know about leading and building teams, dealing with conflicts that you deal with every day in the clinical setting that require collaboration and negotiation. Nurses think with a process that is driven by data. we're really good listeners, we're really good communicators, and as has been said, we're trusted. And it's time that we leverage that trust at the ballot box. So Ali actually mentioned the book by Daniel Dawes, The Political Determinants of Health. And certainly one of those aspects is voting. That's why it's so important. And government, who we elect to make these decisions, is critically important. This is kind of thinking upstream from those social determinants of health. So a great opportunity to put in a little plug here. We have actually been working with Daniel Dawes, who Aaliyah mentioned, for some time, trying to get a date on his calendar. He's very busy, but has been very engaged in wanting to be supportive. So he's actually arranged for one of his colleagues, Nelson Dunlap, to come to one of our monthly events to talk about the political determinants of health. And that's happening in September. One of the things that we do is host monthly events so that you can learn more about all these topics. And they tend to be topics that are relevant whether you choose to run for office or not. And then a plug for our event. I'm holding up my VoteER badge here that we're doing with VoteER just next week to talk about VoteER. Again, really encourage you, get your badge, get engaged. And if you'd like to join us next week to learn even more about it from a couple of nurses who are going to do this. And actually, Tianya, who is in Aaliyah's slides, is going to be joining us for this presentation next month. So let me wrap up here. The message here is that you've learned to do a lot of complex things in your role as a nurse. And all of these things that we've been talking about, registering voters, advocacy, running for office, finding a role for leadership in public service, this is nursing practice too. So I hope you will go to our website. We send out a monthly newsletter. We try to really design our programs, not just for those nurses that are going to run for office, but for any nurse who wants to encourage a colleague, who wants to support another nurse who's running. My email is there, Kimberly's email is there. I know that folks at ANA are going to share this. Thank you very much for inviting us to be a part of this.
Lisa, thank you so much for that incredible presentation. So insightful. A follow-up question that I have for you, and again, can't wait to see the questions that will be populated in the chat, but you brought up the qualities, you know, there were 8 that you shared, but collaboration, conflict management, listening, you know, as these qualities that directly translate to elected office. How do you provide that, that clarity around how those skills directly transfer? Because I think if you asked a lot of nurses about their listening skills and their conflict management, they wouldn't automatically think of elected office per se. So how do you provide that ability for nurses to see themselves in this space with the qualities that they're already demonstrating on a daily basis?
What a great question. And one of the ways we do that, we actually call this in our newsletter, see it to be it. We really depend on nurses in elected office to tell their stories and to be a role model. We have at the first school, there were 4 nurses on our faculty. One of them is running for governor in Delaware this year. And so this year we had 2 nurses from North Dakota and from North Carolina who were on our faculty. And we try every month in our newsletter, we highlight a nurse in elected office. So I think that's I think that helps a lot for nurses to be able to see that and to hear these nurses talk about how they take what they've learned in their experience as nurses and how they use that in their work in political office.
It is my absolute pleasure to introduce our last subject matter expert. Tim Nanoff is ANA's Vice President for Policy and Government Affairs. Tim has 2 decades of healthcare policy and advocacy experience across several national associations. Prior to joining ANA, Tim was the policy director for the American Speech Language Hearing Association, where he led a team of 8 analysts and advocates. Before that, Tim served as the lead federal lobbyist for the American Occupational Therapy Association. Tim has a bachelor's degree from the University of Maine and a graduate degree from George Mason University. Welcome, Tim.
Thank you, Olivia. Appreciate it. And also, I will start by following up where Lisa started. We also have on the line Simit Pandya, our Director of Congressional and Grassroots Advocacy, is also on the line. So he may be able to answer some questions in the Q&A piece or raise something that I didn't share. So I just wanted to talk about being engaged in politics in general. And sort of the focus of this part of the presentation is around why nurses should advocate for healthy public policies. And that's not only just healthcare, right? You know, as was discussed by the previous speakers, you know, nursing expertise in healthcare can also translate to other important areas, and that's important to keep in mind. So grassroots advocacy is something that we've been pressing very hard every year. Obviously, it's a little bit different in an election year where people are all paying attention to sort of what's going on at the presidential level. But we do highlight that members of Congress run every 2 years, so they are constantly in an election cycle. Senators have a little bit of a reprieve where they have a 6-year cycle, so they can get to some governing and business that's not just pure politics. But the way the Congress, with the House in particular, is designed is to make them responsive to the people, in making them run for re-election every 2 years. So some of the things that are critical to think about with grassroots advocacy: strength in numbers. This is where nurses have a fantastic advantage over most other professions. There are massive number of nurses in the country, 5.2 million or more, according to the National Council for State Boards of Nursing. One of the challenges that I saw in the chat was, you know, is nursing a sleeping giant? Can nurses be sort of like a real power in the elections? And I think we can. But one of the challenges we have is that nurses are not a uniform voting bloc, right? You know, there are conservative nurses, there are progressive nurses, there are nurses who care deeply about politics, there are nurses who ignore everything to do with politics, and there are. Our other challenge is the voter engagement piece, where nurses vote at a lower percentage than the average of the total population. So that is something that we want to work on and change. We've been working closely with VoteER in some of these activities, and certainly communicating with our members about the importance of voting. Channeling energy and experiences into action. You know, as Lisa was talking about, you know, if you ask me what a member of Congress's responsibilities are, you know, being empathetic, thoughtful, multitasking, quickly identifying the key elements from a very convoluted background of information. These are things nurses do all the time in their clinical work, right? You're meeting with a patient, you're hearing their story, you're trying to figure out the key points to it. You're dealing with things where you do have direct expertise, but you also are working in broader areas where your experience is helpful to inform your decision making, but you might not have specific expertise. So channeling that energy and experiences is important when you're running for office, but also when you're voting and being engaged and engaging other people's. Ways that we're sharing with our members to getting involved: attending town hall meetings, coordinating town hall meetings and fundraisers, spreading awareness among your colleagues. We already heard about that from the other speakers, talking to your fellow nurse colleagues, talking to your patients, and then directly connecting with legislators is an important thing too. At ANA, many of us focus at the federal level, working with Congress, but we do have a state team, and working with those state legislators is really critical as well. That is where a lot of policy is happening these days. As you may be well aware, Congress is pretty dysfunctional, pretty partisan, pretty separated in terms of what they're doing and not wanting to collaborate together, which means that out of the 10,000 pieces of legislation that are introduced each cycle of every 2 years, we're seeing less and less actually enacted into law. I think the number was around 300 last year. When I started doing this 20 years ago, the number was around 800 to 1,000 pieces of legislation that would move from introduction to passage in a year. We've now dropped that by about a third, or excuse me, we've dropped about 2/3, a reduction compared to where it used to be. Want to point out some resources that ANA provides to get nurses involved and just engaged in advocacy and politics. We use RN Action instead of our main website, rnaction.org. It gives us the flexibility to be able to put information up very quickly. As you can imagine, things are, when they're moving, dynamic on Capitol Hill, and we may have just a week or two to initiate grassroots engagement and get people taking action. But just this year, we've had about 5,300 advocates go to RN Action and take action. Connections are when we're sending information to members of Congress. That's usually about 3 times the number of advocates we have because, of course, we have 2 senators and 1 representative per person. So typically when a person takes action, it often sends to all of their elected members of Congress at the federal level. And we're very excited that this year we had a 500-person Hill Day. We brought 500 nurses to Washington, D.C. in June, connected to our membership assembly. But this year, for the first time, we also engaged students, and we brought 80 students to Capitol Hill, along with our leaders that were attending membership assembly and other nurses that just decided to volunteer and come to the meeting. We really want to build off of that. This year's Hill Day activities with students was kind of a proof of concept. Can we run it? Can we get student nurses interested? And the answer was a resounding yes. We also heard from faculty at membership assembly where Georgetown University wants to bring 150 next year just from that university. So we're actually thinking in 2025, we're likely to do 2 Hill Days, a membership assembly Hill Day in June, and probably sometime during the school year, another student Hill Day that's focusing specifically on that group. Hill Days are known as fly-ins. It was really a great opportunity to bring 500. Last year, we had about 400, so we increased about 100 in a year, which is a great turnout. And we've gotten to the point where we probably are starting to get diminishing returns when we add too many more. That's really another reason why expanding to 2 different Hill Days makes sense. For example, Delaware brought about 35 different individuals directly to the Hill. And when they met with Lisa Blunt Rochester, there were so many attendee nurses from Delaware that they couldn't meet in the office. They had to meet outside on the steps of Capitol Hill. A good problem to have, but also sort of talks about the challenges of coordinating a massive Hill Day. We're really excited about that. We had over 350 meetings with individual congressional and Senate offices, and we met with about 60 plus direct members of Congress and their senators. So those were meetings with the representative or the senator themselves. Great engagement to get visibility out there for nursing. In this election year, we're working closely on getting out the vote. We've done that during the primary season, which is ongoing, but we have a plan for a big push at the end of the year as well. The Nurses Vote webpage is kind of a screenshot of it there, and you can see VoteER is prominently included there at the bottom, as well as RN Action, where people can take direct action on issues of priority for ANA and nursing. And then the Voting Center. The Voting Center provides information about deadlines and registration information specific to every state. So we give you the information about when the deadlines are to register, when the voting days are, when early voting starts, what mechanisms of early voting or remote virtual voting are being used in your particular state. And you can't do it here because it's a screenshot, but if you scroll over a particular state, it will pull up the information from that state so you can quickly and easily find the information that's most relevant to you. So I do encourage everybody to take a look at nursesvote.org. It's a good resource and a hub that you can also share with other colleague nurses that gives them a lot of information very quickly in one place, as well as connection to ANA so they can get more information on other on other topics as well, political topics. When people register to vote and they reach out to us, we send them out this registered nurse, registered voter pin. We've sent out hundreds. We're hoping to send out thousands across the rest of this year. It's just a good way to sort of demonstrate your willingness to vote, and it can start conversations. If you're wearing that on your scrubs, you can have conversations with your other colleagues and also your patients even. You notice that you've heard from a couple of the other speakers as well. ANA tries to be a nonpartisan organization. We try to be as bipartisan as possible, working with Republicans and Democrats. We say nonpartisan because we also work with independents, and it's not about your political affiliation. But that doesn't mean we aren't issues driven and make decisions on who to support based upon our issues. That is one of the advantages of being a 501c6. We can be a little bit more politically active and engaged. And so while we do have a get out the vote and voter registration that is very nonpartisan, we also do share with our members information about where the candidates stand. And on our Nurses Vote website, we are going to be issuing a issue alignment scorecard with a picture of presidential candidate Vice President Harris, former President Trump at the top, as well as 6 or 7 of ANA's top priorities on the policy legislative front, and identifying where each of the candidates stand in regard to ANA's position. That breaks down. There is support for ANA policies on the Republican side, on the Democratic side, and it varies based upon the individual topics. So we share that information so that people can make their own educated determination of who they would like to support. We know and recognize that when people go to the ballot box, they are not thinking exclusively about the value to their profession, right? They're not only thinking about healthcare and about how this affects nursing. But we hope that that is a part of what they're considering, and some of the the big picture items that are important in these culture war times as well. So getting back to why nurses should be advocates for healthy public policies, nurses actually get to see the impact on our healthcare system. So much of our healthcare is driven by government policies, and I think that people don't necessarily understand that as much because we have such a prominent private healthcare, private insurance system with United Healthcare and Cigna. But Medicaid remains the single largest health insurance plan in the entire country. Medicaid, not Medicare. Medicare is the second. And then private insurance is the third. United Healthcare in particular is the third single biggest insurer in the country. But those public programs really do drive a lot of policy. And healthcare systems are set up around those public programs because they drive so much revenue. So nurses get to see the impact of public policy on their work and on the impact it has for patients. As we talked about before, there's plenty of public trust in nurses. So your opinion does matter, and it does carry weight more than you probably believe. There are 5 million nurses, and we have power in that collective role. And then healthcare providers are natural advocates. Every day, nurses are advocating on behalf of their patients, their colleagues, their facility. Sometimes it's a little bit more removed to think about advocating for yourself and your profession as a selfish type of approach, but it's not, because if we're not advocating and sharing our expertise and knowledge, someone else without that information and knowledge is going to be doing it. So that phrase that you may have heard many times, if you're not at the table, you're on the table. So if you're not there and actively voting, other people are going to take care of that for you. So that's really important to just keep in mind as a priority for being engaged and active. Wanted to highlight a few advocacy wins just over the past year. These are important things because the work that we're doing at ANA and the support that our members and nurses and other nursing associations provide really does change things on Capitol Hill. Nursing funding was increased while almost every other federal program was flat funded for 2024 because of the challenge that the Congress has of making decisions on how to fund programs. But nursing programs in Title VIII, which is how training and education for nurses is funded by the federal government, actually received a $5 million increase. While that is very moderate, it does show that Congress is paying attention to nursing while they flat funded other programs that didn't give them an increase. The Centers for Medicare and Medicaid Services also issued a final rule at the beginning of this year that established staffing standards and a minimum number of time that patients in a skilled nursing facility need to have with a registered nurse or an aide. That was something that was really critical. For many years, CMS, Centers for Medicare and Medicaid Services, had said they didn't have the authority to do that. Now they have done it, and we're hoping to be able to build off of that success and try to do something similar in acute care hospitals and other settings where nurses are working prominently. The Lorna Breen Act provides some wellness training and education information for nurses and funding. It allows for mental health care and treatment and services for nurses. Congress passed that in a bipartisan manner. Originally back in 2022, we need to get it reauthorized so that those programs can continue. We are seeing broad support from both Republicans and Democrats on that. And then the last two things we're going to touch on quickly are state issues, where we're telling you things are getting done more frequently because, within particular states, they're able to sort of identify the issues that are most important there and move forward either in a partisan manner in a state that is either red or blue, or be able to work together a little bit more closely, because in the state level, there tends to be a little bit less of that national partisanship that is out there that really disrupts our Congress lately. So we've been able to pass surgical smoke legislation that would require facilities to evacuate surgical smoke that happens in the operating room. 18 states have passed that legislation, 3 in just the past year, and we are looking at federal legislation moving forward to try to fix this problem on a national level. But the states are doing a good job of getting it started. And then full practice authority for advanced practice registered nurses. 27 states have now expanded full practice authority. You may have seen the American Medical Association is putting on a full court press against nurse practitioners and advanced practice registered nurses as not being as qualified and trained as physicians. But one point that we note is that of the 27 states that have expanded full practice authority, 0 have ever gone back from that. So when states have expanded full practice authority, none have experienced any of the concerns or problems that are raised by the AMA as consistent. The other thing we will note that I think is particularly important is that there's no change in malpractice insurance in a state that has full practice authority versus a state that does not. So the insurers that are really worried about money and their costs see no additional risk by allowing advanced practice registered nurses to have full practice authority. So a couple of key elements on advocacy wins that demonstrate that being active and engaged really does ultimately make a difference. I wanted to share the issue alignment scorecard with you all to see, but because we've had President Biden step down and we have Vice President Harris in there, we are revamping that scorecard and going to be issuing it out immediately after the Democratic National Convention. We anticipate during that convention, we're going to hear speeches from candidate Harris, as well as Vice President candidate Walz and others that are talking about healthcare, and we want to make sure to capture their current positions. While Harris and Biden may be very close in their positions, there can also be some variation. So we will be sending out to all of our state affiliates that scorecard and posting it on the Nurses Vote website immediately after the Democratic National Convention. So you can get a sense of where the issues stand, where the candidates stand on the issues that are most important to ANA. So with that, I think I will leave it there and look forward to the discussion. Thanks.
Wonderful, Tim. I just have a couple follow-up questions for you specifically before we open it up to all of the subject matter experts. People want to know how to get the registered nurse voter button. There's a lot of people that want that button from RN Action. So can you kind of describe how to go about doing that?
Yes. So the best way is just to reach out directly to us. I can put in the chat a couple of email addresses where people will be able to send a message and get that out there.
And then another question that came in is that we need to get students more involved. And having had the pleasure of attending Hill Day myself, I know you said you pilot tested and had a group of students this year. What was some of the feedback that you received from the students who were able to participate?
The overwhelming feedback that we received was that it was very empowering to them. They were a little bit intimidated by thinking about trying this for the first time, as many of them were the first time going to Capitol Hill. But when they were there, they received the briefing ahead of time as well as on site. They felt like they were prepared and engaged. We do try to partner them with some people who are experienced, if at all we can. But that sense of empowerment was important, and also the ability to pick and choose some of their issues. We provide 4 issues when we go to Hill Day that we want people to consider, and they can look at those issues and think about which ones are most important to them to spend the most amount of time they can there. We're going to facilitate this to make sure that they're integrated. One of the challenges we had this year, because we had some space capacities with the size of the room for our Hill Day, we had a briefing for the membership assembly, and then we had a separate briefing for the students. We really want to make sure the students are included completely next time in however we're able to do that. So a couple of lessons learned along the way, but I think one of the things that we really learned about the students were that many were interested in participating more during the school year, but that doesn't preclude a big cohort of being willing to come out in the summer as well. So we're looking at a time to sort of maximize their interest and availability.
Thank you so much for that, Tim. I'm going to go ahead and read some of the questions that have been coming in the chat. So feel free, Lisa, Aaliyah, or Tim, whoever wants to kind of tackle these would be wonderful. The first question that I wanted to share was, how can we get our professional organizations to support our efforts to become politically active?
I think I can take that one, or at least I can start on that one. I think getting actively involved in your state association or the national association is really important. Now, not everyone can run and be a part of their board, but being a vocal member is really critical. And making sure that the membership is speaking up, talking to the leadership of the association, and sharing their perspectives. We had, as you can imagine, a lot of really good engagement and debate on, should ANA be endorsing a presidential candidate? How are we using our political action money? That kind of feedback is really important because we are member-driven organizations. And the leaders, member volunteer leaders that are elected by the membership, drive our approach. And if that approach isn't exactly what you'd like to see, there's a way to resolve that, and that's by getting engaged, showing up and having those discussions, whether you're running yourself or just sharing your perspective with those leaders. I think all of the volunteer leaders I've worked with across all the associations that I've worked with really want to represent their constituencies and their membership, but they can only do that if they're hearing directly from members.
And I'll just comment on that as well. That's a great answer, Tim. I would say from our perspective at Healing Politics, trying to engage professional associations, and I'll just step back and say one of the reasons we incorporated as a 501c3 as an independent organization rather than find a home in a school of nursing or one of the professional associations was we really wanted all nurses to feel some engagement and some ownership in this work. So as we've reached out to associations to partner with us at Healing Politics, it's been really interesting to see the response from organizations like ANA and the AONL that jumped right on board, wanted to sponsor our campaign school. They get that nursing is political. Some organizations have been a little more cautious, as some of them have been pretty cautious. So I would just reiterate what Tim said. If you're a member of an organization, your organization is serving your needs. Let them know that political engagement is a priority for you. And then you said you were referring to the fact that running, marketing yourselves, et cetera, can take time. It is true that making a run for office involves a lot of preparation. That's why our campaign school is basically 2.5 days of preparing nurses to do that. There are a lot of other ways that other organizations looking to increase the diversity in our elected offices are stepping up and interested in nurses. So I'd be happy to talk more about that if you want to email me, depending on what your interest is. But I think that's really important. And the amount of time that it takes to actually serve is really dependent on the office that you're running for.
Another question that was populated: would like to hear thoughts from the speakers about the homelessness crisis as a public health issue and nursing advocacy around that.
I'll make a quick comment there as well. I think it's, when we think about homelessness, it's clearly a social, where the built environment, the structure, whether you have a home or not, definitely a social determinant of health that has direct impact on a person's ability to live successfully, engage in all the things they need to do to have a successful, happy life. So I think that's really the focus that ANA has taken on it, is making sure that we're in support of efforts to try to have a focus in healthcare on social determinants of health. And we've seen that from the federal government in regard to programs that are allowing expenditure of Medicaid dollars on things previously considered outside of healthcare, like transportation, like housing, those type of elements. Using actual Medicaid dollars for that is important transition and something relatively new that we certainly support. And the other piece is, I'd like to see ANA do more with engaging private insurers, but we have seen private insurers also recognizing social determinants of health as a business mechanism of causing increased costs for them. In terms of healthcare. So when they look at compliance and what happens at discharge, they're starting to take into account factors such as homelessness, such as lack of transportation, lack of appropriate nutrition and food, and using some of their insurance dollars to address those conditions. It's not happening nearly as frequently as it needs to, but there's some progress being made there.
And I would just add to that it's one of many issues that when we think again at Healing Politics of why do we need nurses and a diverse group of nurses to step up to run for office, it's homelessness is not something that many of our elected officials have experienced or have direct experience with trying to help people. So I think it's one more example, again, as Tim said, of those social determinants of health that nurses are particularly attuned to. And I was just remembering some really compelling photographs of Cori Bush on the steps of the Capitol to raise awareness about the unhoused and policy solutions. Part of her biography, part of her history is that she spent a period of time living in her car. And it's one of the things that she talks about in a really compelling way. Just another example of the power of stories, whether they're your personal stories or stories that come from your work as a nurse.
Another question for the experts: what are the best actions to take to counter the many messages of health misinformation that we receive on a frequent basis?
What we know from research is that official sources, as best as you can use them, are best. And that's why VOTR and our voter registration work, we partner directly with Secretary of State's offices in a group called TurboVote that basically has a partnership with all the different Secretaries of State's offices. And that way, the information that people are seeing and receiving, they're receiving straight from the source. This is a really, really tricky one. And so I don't want to pretend to have all the answers, but VOTR goes out of our way to work with behavioral insights leaders and people who have done research on this to make sure everything we're providing is received as credible and that we are providing the best information possible. We vet all our tools to make sure there's not a risk that somebody's getting the wrong information, because that reduces trust to the different systems. So that's a starting point on that topic, but it's a really hard one.
Op-eds are a really powerful tool. And if there's misinformation out there about something that you know a lot about as a nurse, one more example, or maybe it's not from your work as a nurse, maybe it's your work with an advocacy group on anything. It's a way to use that trusted voice, and you can address that misinformation with facts and truth and a compelling story in an op-ed. One of our events, I think it was at the beginning of the year, was with a nurse who's a fellow of the Op-Ed Project. And if you have an interest in learning how to write op-eds, the Op-Ed Project has some great resources. And one of the reasons we wanted to do that was we're looking for ways that nurses can get accurate, important information to the public.
One challenge, I think it's different too when a professional association or a business is trying to say something in their space. They kind of have an authority that comes from their perceived expertise. Individuals, I think it can be a little bit more challenging. And one problem and challenge that we do have is that sometimes people are so ingrained in where they are in their political positions that facts don't matter as much as they used to. I think that's something that's problematic and a concern for our democracy in general. But sometimes then meeting people where they are and having a conversation around where their experiences are could be helpful too. This is a little bit off topic, but one of the things that we talked about with Hill Day and getting members engaged, and they go into an office and they're going to talk to a very conservative, progressive member that has a different perspective than what we have on a particular topic. And we may not get to agreement on the solution, but can we at least agree on the problem? And can we define kind of what the problem is and agree that there needs to be a solution? That opens the door to future conversation that creates some opportunities. So you might not be able to convince your friend on social media that in fact your position is right and theirs is wrong, but can you sort of work towards an agreement on some challenges and that we should be working together on a solution? That in this environment sometimes is a big win.
Another question, how are we engaging the other nurses unions? Do we know how they are being engaged?
The ANA, of course, is no longer a nursing union. And given our history, we've had some changes there. We do work closely with some of the unions. We have 8 states who are directly affiliated with unions, and all of which are affiliated with the American Federation of Teachers as their primary union. So we do meet regularly with their government affairs folks and lobbyists. We worked closely with various AFL-CIO entities during the effort to try to get the Centers for Medicare and Medicaid Services to pass that staffing regulation. So we do have dialogue and partner with them. There are some unions that have a challenging relationship with ANA based upon old history, but we do try to keep the dialogue open. And there really, in my mind, is no conflict between a professional association and a union. We do different things. And sometimes there is some overlap in touching, but there's things that a professional association can do on behalf of an individual or a profession, and things that a union can do. And both are really critical to nurses. So whenever I'm engaged with folks that are having a conversation about unions, I want to point out that we can work in partnership and in collaboration, and we do, and we should do it more.
Tim, another question for the ANA. Will the ANA site include an analysis of Project 2025 and the impact on healthcare?
Excellent question. So at this point, we have not done that. I think that could be a very good blog post. We have a Capitol Beat blog where we sort of have conversational discussions about topics that people can share. That could be a good venue for it. Project 2025 is a massive document, thousands of pages long. So a complete analysis that we could post and share wouldn't necessarily be helpful. But I think having a conversation around the trends, the philosophies, and the key elements that, from our perspective, are concerning about Project 2025 would be worthwhile for us to share. We haven't done it yet, but I'll talk with the team about that blog potentially.
Another question, was the AMA behind the recent article circulated on Medscape voicing concerns about the lack of sufficient clinical practice in APRN education?
Yes.
In relation to the Bloomberg article.
Yes, absolutely. The AMA has this scope of practice initiative that they've been working on for several years. In election years, they tend to push it forward again. We worked with AANP to develop a response, so we worked with some of our affiliated nursing associations to respond. But we've been working on this for quite a while. This is a new chapter of a very old book. And one of the things I suggested recently to our brand new CEO is to try to have a CEO to CEO discussion about this, because our healthcare system needs APRNs, doctors, LPNs, they need everybody. So I think we need to get out of this turf war and start focusing on what's in the best interest of of consumers, and I think we'll see that.
Another question from the chat: are there any efforts underway for cross-discipline advocacy?
So at VODR, we have the VODR Fellowship, and that's led by Nobel Peace Prize nominated faculty that helped kind of lead the transition of Serbia into kind of a democracy. And that group, when we recruit, we deliberately ask people to bring in multidisciplinary teams into that. And so that's an example of a space where we really prioritize and focus on teams that come in with people from different professional backgrounds. And that can be like, in some cases, it'll be, say, for example, nurses from a number of different states, but in many cases, it will be a combination of physicians, nurses, and admins at a hospital all working together on their VODR project. I would say, and Tim, I was grateful for your transparency with the last question, and just want to name, like, at VODR for us, multidisciplinary collaboration is actually one of our core values, because it is so important to us to make sure that we're looking at the health field as a whole. The health field as a whole is 12% of the workforce. But if you split it up into tiny little groups, can't get enough done because it's fragmented, right? And so you have to put it all together to have the true leverage. And we're big and focused on that. And I'll drop the link in the chat for the fellowship.
I would add that ANA works very closely with other healthcare associations. We are part of a coalition called PARCA, which is an acronym that doesn't even mean anything anymore. But ultimately, it's physician assistants, social workers, OTs, PTs, all the non-physician groups get together to collaborate and work together. But we also work very closely with the American Medical Association, the American Hospital Association. While we disagree on certain topics, we try to find common ground on plenty of others. And it's an 80-20 scenario, right? We probably on the same page 80% of the time, and then there's 20% of high visibility issues that we have some challenges. But we do try to collaborate and work very closely with other healthcare providers, particularly the non-physician groups.
And I'll just jump in. I don't think it's entirely what the question was addressing, but I want to mention that while the campaign school was developed for nurses and midwives, there are lots of campaign schools out there. And we would make an argument to nurses who want to run for office. There may be a huge advantage to you going to a campaign school where you'll be with lawyers and teachers and business people and other people who are interested in running for office. And as a matter of fact, in talking to the students early on about their project, I said, wait, why should we reinvent the wheel? There's all these campaign schools out there. Let's just try to encourage nurses to go to existing campaign schools where they not only can they meet other people, but just think about the impact of a nurse in that group of other professionals. I think there are a lot of good arguments for having a profession-specific campaign school, but there are plenty of campaign schools that would have a diverse group of people in them, if that's something that you're interested in exploring.
I'll pose this question to all of you. What are some of the emerging trends that you've been noticing that you think are important for nurses to be aware of? Anything that comes to mind?
The first thing that comes to my mind is the whole issue of civility and sort of the way we engage each other in politics, particularly in this year. It's so easy to get on social media and just sort of lash out and go into your tribal pages and just sort of hit those echo chambers. That's something we really need to be mindful about for all of us. There's also this perception that we're listening to sound bites on both sides, where someone says something and then the other candidate kind of tears it down completely. It's really important to do that due diligence. I think in the election cycle, we hear many times, and there's a lot of discussion in the chat about Project 2025. What really is it? And who's behind it and how is it connected to the different parties? It's important to understand those things and not just sort of have a knee-jerk reaction to one or two of the elements that you see there, but to look at it. And sometimes by digging in, you may be even more concerned than you were at first, or there are other elements that really aren't as problematic. But I think that's important. At ANA, we're really focused on work environment issues for nurses. what's going on with staffing, with mandatory overtime, with workplace violence, and also work environment, and then workforce, which is the pipeline, the training and education. So those are two of the big trending areas that we're working about, and they are very connected to each other. Congress gives a lot of money to recruit nurses and to train and educate nurses. And then 20% of those nurses are leaving within the first year after graduation. It's because of the work environment. So if we're going to fix this problem for the way that nurses are working, it has to be to address both the workforce and the work environment at the same time.
I'm not sure exactly what you were thinking of when you asked about trends, Olivia, but I was just rereading the paper that was cited in one of our slides by Darlene Curley about nurse legislators. And one of the disturbing things about that paper is that the number of nurses serving in state legislatures declined rather significantly between 2013 and 2023. That's a really concerning trend to us. And so we're really interested in, Kimberly's doctoral work was about barriers and facilitators. What can we understand about what the barriers are, and how can we facilitate more nurses running for office? And not to leave it on a negative trend note, I would say what I've really seen in the last couple of years is the number of nurses who've said, wow, I never really thought about it, but yeah, I think I could do a better job than the people on my school board or my city council or my state legislator. That I think nurses are beginning to envision themselves in those elected positions. And I think that's a great trend. Maybe we'll counteract the first one I mentioned.
When we think about our work at VODR, one thing that I think is important, and I would emphasize this right now, but also if we were in, 2020 or another sort of like so-called, presidential year, elections happen all the time. The opportunity to run for some of the different offices that Healing Politics talks about, sometimes the best opportunities for those happen in odd-numbered years and the year after a major presidential. At VODR, what we're out to do is make sure that the folks who are suddenly fixated this year, in part because there's some big thing on the ballot that they're going to hear a lot about because of the money poured into the advertisements, we want to make them lifelong voters. And so for us, really harnessing these moments, not just so that we can achieve record turnout in November, so that we can become a stronger democracy by having more voices heard, but also that those folks who engage this year, whether it's through advocacy through nursing, whether it's through VODR, that those same folks then engage in the years ahead when so much of the sausage gets made. I guess I don't have the vegan version of this analogy, but I just want to name how important it is that we sustain things regardless of what the media cycle is telling us to do.
One quick comment I'll make regarding trends too. I think it's important to mention this trend about challenges to diversity and speech are big issues that are going on in our country right now. From both the left and the right, you hear that there's concerns about limitations on speech, there's limitations on recognizing and celebrating and empowering different types of diversity. Those are trends we need to keep in mind, because we think it's important not only in and of itself, but because of how it impacts the ability of nurses to do their jobs. How they're trained, educated. Does our nursing workforce represent the communities in which they serve? All of that stuff we know empirically is important, not only philosophically, but from quality and outcomes perspective as well. So those are some trends that I know that we're tracking as well, among many others.
Thank you so much. Thank you so much, Aaliyah. Thank you so much, Lisa. Thank you so much, Tim. What an enlightening and inspiring conversation. This chat has been phenomenal. The presentations have been phenomenal. We're going to drop a link to a survey, if you would be so kind as to fill out the survey to give us insights into your experience with the lounge today. But I'm happy to turn this over to my colleague, Casey, and just thank you all so very much.
Thank you, folks. I know we're at time, so just again, a huge thank you to our wonderful, wonderful speakers and to our great audience. Again, this is wonderful engagement. We really appreciate you spending your evening with us and this recognition of civic engagement and its relationship to health and how nurses can be a part of this work. As Olivia said, dropping a survey in the chat. Also invite folks to apply to our innovation awards, the ANA Innovation Awards. policy and advocacies and innovation folks, right? So invite you to apply, and thanks again. Happy Civic Health Month to all.